So much so that it is not uncommon for dry eye sufferers to frequently change ophthalmologists in pursuit of some form of relief. Dry eye syndrome, clinically known as keratoconjunctivitis sicca, describes the changes in the eye resulting from either a lack of tear production or an excessive tear evaporation, and covers a range of tear film to ocular surface abnormalities, including burning, stinging, itching, tearing, blurring of vision, dryness, soreness, foreign body sensation, and photophobia. Along with these symptoms, the potential for ocular infection and damage to the cornea are also present.
I think I was just more shocked because I had cancer, and it's the one thing that you never want to hear, and when it's verbalized to you, I think regardless of age, you know, it's going to take you back and cause you to really think long and hard about what do you do to go forward.
I didn't want to have a mastectomy, but my husband and I talked about it. If we had to, we would. But I just thank God I didn't have to go through that. So I'm very grateful.
I listened to all my options as far as treatment was concerned, and then I find one that fit my lifestyle the best and that had good results and that would work for me. And fortunately, I was a candidate for the Contura, and it did exactly what I'd hoped it would do.
These are just some of the thoughts that a woman who's been diagnosed with early-stage breast cancer may have. Nearly all women diagnosed with breast cancer require some form of surgery as part of their treatment. A mastectomy, in which the entire breast as well as surrounding muscle, tissue, and lymph nodes may be removed, was once the only surgical option for breast cancer patients. Today, however, there is an alternative that exists for many patients, which is called breast conservation therapy. Breast conservation therapy consists of a lumpectomy and radiation therapy. A lumpectomy has now become a commonplace procedure in which the cancerous tissue and an additional rim of tissue surrounding the cancer are removed. This is followed in most cases by radiation therapy, which targets the remaining cancer cells, hopefully preventing them from reproducing or spreading, reducing the risk of recurrence.
Catheters, we did not have the ability to limit the dose to the skin or to the chest wall. With the Contura and the 5 lumens within the balloon, we can customize the treatment for each patient, and that really is a benefit. It reduces the risk of radiation exposure to other parts of the breast and body.
The Contura 5-day treatment plan. Placement. Typically performed in the doctor's office 2 to 3 weeks following the lumpectomy procedure, the Contura balloon is placed inside the breast. Once inside the lumpectomy cavity, the balloon is inflated with saline solution until it fits snugly within the cavity and will remain inflated inside the patient's breast during the 5-day treatment. Once the balloon is inflated and in place, gauze padding is placed around the catheter and taped down so that the patient can move around freely between treatments.
There are no limitations. I have no limitations of what I can do. I can do anything I did before I had any of this going on in my life. It's pretty much back to normal, actually.
But now it's over, and I'm getting my strength back, and we watched our grandchildren last Wednesday night, and we had the most fun running around and everything, and it was beautiful like old times.
And so I was able to do all that my job required, and with no problems. I was part of my school. I didn't feel like I had to sit in my office and, you know, just do paperwork. I was able to be out and about with the kids and with the staff, and that was important to me. And the day school ended, you know, you go back for your treatment, and you couldn't ask for a better way, really, to treat your cancer than being able to do the things that you love doing, being with the people that are important to be with, and knowing that at the same time you're going through treatment to take care of the cancer.
The Contura Multi-Lumen Balloon Breast Brachytherapy Device. From Cenerex. Innovative breast care at every step.